Hello, everyone. Here we are with another episode of Health with Harvey, where we are enjoying a beautiful, gorgeous autumn day here in the Riverland. And today I'd like to talk to you about what's something called IBS, or Irritable Bowel Syndrome, tummy troubles, which are so common. Now, a lot of people don't talk about it, but they are starting to talk about it a bit more. And it's important, if you have these things, to come in and see your regular GP and get checked out to see if what can be done to improve the situation. So some of the common symptoms are feeling bloated. You can feel a bit nauseous, have some tummy distension. For some people, they feel a bit bloated. They get some discomfort and pain with it. They can have diarrhea. Some people have constipation. Some people can cycle from one to the other. What's really important when you go in and see your doctor is to tell your story, because nobody's guts are like your guts. And you might have already started to notice that there's just some foods that don't agree with you. And so we need to take all this information on board, and there's often some questions that are important to ask. So typically, at the start, we want to make sure we're not missing any of the big baddies. And so often we'll look at some blood tests, a poo test. And there's things that are called hydrogen breath tests, where we can look at whether someone has trouble digesting some of the sugars or not, and how that can influence your gut health and your symptoms. And if someone's come up with some history or some results that are concerning, certainly something like a colonoscopy needs to be considered. So what that initial assessment is typically to look at, are we looking at irritable bowel syndrome, and making sure we're not missing anything else that we should be treating in a different way. Then the next step is to have a good look at the diet, because Grandma was right. You are what you eat. And you would only put premium petrol in your car, wouldn't you? And so when we're not doing so good with our diet, we pay the consequences. And as I said earlier, some people don't digest foods as well as others. And that's just sort of how the cards have been dealt with us when we genetically came along. And so what happens is, it's important to look at an elimination diet, something that's called FODMAPs, which is an acronym that's shortened for some really long, complicated words to say, as well as looking at things like gluten. And looking at bringing these things out of your diet, and when your tummy settles down, reintroducing things one at a time so we can identify the culprits. The other thing that's important is your microbiome. And man, are we learning more and more about how important this is on our health and well-being. And it shouldn't really be a surprise. They've evolved with us, and they've evolved for us. And so we need to nourish them as well. So that's often with our diet, which is an important discussion to have. And for some people, it might be a good idea to try some probiotics. But the trick with probiotics is there's a lot out there that just aren't effective. People are riding the bandwagon and selling things. So it's really important to get probiotics that are effective, if that's something that your doctor feels that would be a benefit to you. There are some medications that can change how sensitive your guts are, and that can be helpful for people. And really interestingly, what's coming along is finding that hypnotherapy is quite effective for irritable bowel syndrome. I'm really not surprised. I mean, if you're worried about what you're going to eat, where you can go when you eat that, whether you're going to have tummy upset, do you stay at home, can you go, you start to get anxious and stressed with that. And guess what? Whenever we're stressed, we get the butterflies in our tummy. So it just shows that our mind and our body is connected. And the brain has neurons that use the same neurotransmitters as the neurons in our stomach. So it really all interlinked. And so if something as simple as hypnotherapy that's really directed at irritable bowel syndrome settles things down for you, that's fantastic. And certainly there's nothing to say you can't have all on board to settle these things down for you. Now, should someone this not be effective for them, then it's time to start to consider a specialist, someone who specializes in the gut, like the gastrointestinal surgeons or your local general surgeon. I hope that's been a benefit to you. And as always, any questions or concern, get in touch with your regular GP. Wishing you health and happiness from Living Well with Dr. Wilson from Harvey and I. Take care and enjoy the day.